That's what his job is.
Purple Feather, it's a video called called Blind Man and Purple Feather, and it's about 1.5 minutes long if you can find it, but I can explain it and then if we have time to watch it.
So he'll find it, and so you just keep
I won't
going.
explain it.
Okay, so you can explain it, but he'll also find it.
Okay, thank you. Oh, wow. Okay. Yes, that's
Delegation.
Great team members.
What else can we do?
So, yeah, I tell
She
people,
already talked
everybody
about
should have a norm.
Thank you. So, between Edelman, so my first job out of college, I worked in pharma, carrying the bags, devices, diagnostics. Pharma was on the fast track program, worked for Discovery Channel in education, perinatal home care. Edelman I came into because they needed somebody. I had to do a lot of IT work and health analytics. They had a client called HIMSS. So if anybody's in healthcare understands HIMSS, it's Health Information Management Systems. Thank you, Davis, for
Yeah,
it.
absolutely.
And what was happening is in business today, there's a mind shift switch. It's not only for somebody to be able to sell or do communications, but it's really looking at the business goals of an organization. And so from the largest PR global firm, which is Edelman, their clients were asking them to help with their business goals. So they wanted subject matter experts to come in. So I came in as a subject matter expert in healthcare, and specifically health IT, and how we could work with HIMSS. So HIMSS they're the largest not-for-profit today. It used to be the NFL, but now it's HIMSS. And about $40,000 people a year go to their annual convention, and they have all the health IT. It's pretty cool. So that's actually how I came in, to basically translate healthcare, IT, and communications. So I learned a lot about media and PR, which wasn't my background before I came to Edelman.
So, story in healthcare. Where did story come into this journey between? Okay, so you had story as Miss India, and we
I
had
don't really
story
tell
at the
people
end.
that though.
But where did you find story in there?
So it's interesting. So I ran a device company. We were in 93 countries. India was one of our countries. I had to go speak at Apollo Hospital. And I walked in, and I was vice president of healthcare. And my picture of when I won Miss India was on the screen for all the surgeons. And I was like, oh my God. And I was really upset because I was like, I'm not here for this. I'm here because I think I'm smart. And I'll never forget the guy, sorry, but the guy said, don't invite any more people to come if they think you're Miss India. I was like, oh my God, seriously? So everybody came to hear me speak because of that. And I thought, you know what? Fine, that's the story. It's going to get people there, and it's going to help them shift and understand about this neuromuscular technology and how it's going to help their patients, I'll do it. So that's, I think, another lesson, like in terms of telling the right story to the right audience, even though it may not make sense, how to get the outcome you want.
So,
So I just want to point that out, that you taught me that about humility, because what you think, is the Miss India was kind of a humility thing, and here you are trying to build this empire of healthcare, and they bring this in. It's so important that people connect with the gift that you have. Like for me, I went to a conference that they set me up on, and I never told anybody that I had dyslexia.
Yeah.
And it didn't impact as many people as
After you said that.
right.
Yeah.
So I think it's important that that's the foundation God gives us, is to stand upon whether it's
Yeah.
being observed for the outer attraction, but yet it allows people to take the second glimpse to look at the inward attraction.
And I like that you said that, because I feel like our society, if you look a certain way, right, we judge. It's human nature, right? We want to box things. Kids don't. We taste something, we're like, oh, it tastes like this. No, it tastes like that. Like, we don't have to put it in a box with something that we already know. And so for me, I was like, I don't want to be judged as other people that were those beauty queens, because it was all about, and some of the women I met, was about the external. It wasn't about like my dad saying, you've got 364 days to do something. So you're absolutely right. Go ahead, May.
I'm sure you know that, but I'm just going to reiterate it. Do you realize that what you did as Miss India is the same thing what you're doing now?
Yeah.
Yes.
It's in the concept.
Because I tried to hire a girl at Hooters to be one of my sales reps at one point, so I do.
In the sense,
She was a lobotomist and she was amazing.
right,
Yes.
in the sense that you're trying to teach.
Yes.
Yeah, so I mean, there was a point, but people understood it in a different way, that the condom giving,
Yeah.
that was the only way approach,
Yeah.
but you had a different angle, and you came and you solved it. And this is what you are as subject matter. It seems to me
Yeah.
that you go with a bigger problem and you understand all the bits and pieces, and so you can say, yeah, I miss India, but look what I did. This is
Yeah.
what I did.
And I think, yeah, thank you. You're right.
Oh, no, so let's,
Sarah hasn't seen these, so I don't know if they're relevant.
no, so, yeah,
Do you want to go to the next one?
let's see the,
So this is when you say,
so let's tie in, so
Okay.
the thing about tonight that was really exciting for me is that we're talking about this piece about customer journey, and
Right.
she's translating all these things, and she's this uber professional, because you can feel that tightrope that she's walking. And then one day, all of a sudden, there's this diagnosis, and instead of it being this very intellectual piece,
Right.
it becomes very personal.
It was, I mean, it was personal, and for anyone in the room who's gone through trauma, like I actually, and I've been in healthcare my entire career, so I would do tumor boards, and I would be in hospital settings, and I had to approach my sickness. So what happened was, I am non-compliant with my cholesterol medication, and I'm bad. And so my doctor said, why don't you just go in and get a CT? And so I went in and I ended up having a mass on my upper left lung. And,
But that has nothing to do with you being non-compliant with your cholesterol medication.
no, but thank God I went in to check it, right? Because otherwise, we wouldn't know, right? And everybody kept saying, like my brother-in-law, we're hoping it was TB, we're hoping it was something else. But it was just crazy, so I was like, yeah. But every time I had to talk about this case, it wasn't me. And I realized that whoever I talked to, and you'll see kind of in my journey, it was always patient presents with this. It wasn't me. It was patient who's 49 years old, presented with a mass in her upper left lung, it's about 3 centimeters, it's da-da-da-da, and I could not deal with it. And it was like communicating that story in a way that I'm like, why? And so this is pretty much like what happened. Like it was me, 49 years old, it's probably 2 years ago now. No symptoms, no family history, no cancer in our family. You know, I smoked when I used to bartend a little bit back in the day. Nothing where I would be a smoker. And I ended up having stage 1 cancer. And so that, and part of our lives, you can be the victim or you can say, why does this happen for us, right? It's not happening to us, it happens for us. And so what am I gonna learn from this? I'm sorry.
How many stages are there?
Only 4.
Okay, thanks.
Yeah. So it's early, and they caught it. And ironically, so I launched the first non-small cell cancer drug called Xalkori.
No.
And how old were you when you did that?
I was 38.
Oh.
And it was for patients with stage 4 with exactly the same type of tumor that I had.
Oh, man.
Yeah. So I was like, this is
Do you think you caught it from them?
from some of the patients. But so what I had to do, I had to sit with patients who had stage 4 and ask them, and it's funny, like, when you talk about God comes full circle, I used to say, how do you feel? What are you going through? What emotions are you feeling? And now going through it, I was like, oh my God, I was horrible. Like, there's no way to articulate the emotion and the depth and the feeling and the fear and and here I'm asking for these patients who just had stage 4 lung cancer and they're going to be on Xalkori, and we had I used to work for Abbott, it was companion diagnostic. And I'm asking these patients, like, okay, so tell me, when you were diagnosed, what did you, and it was like, in my face, like, I'm like, oh my God, if somebody like me had asked me this now,
Yeah, right.
like, so it was different, it was an experience. No, next one, I don't even know what slides I put together, I just know it's like, oh yeah, so now I'm a new normal. So, this is just some of my experience, and what that means, but that's what I don't have.
What's Montreal?
Maitri is a perinatal home care company, they were bought out by Lear.
What does that mean?
Oh, just some place I worked. But my experience, no, don't care.
So which part is it that you don't have?
The one that's highlighted and says all gone, my friend did this.
The
The
whole,
surgery?
Wow, they took
left
out
lung,
your
yeah.
entire
Yeah.
left lung?
But I still play pickleball and tennis today.
Right.
Pretty good, yeah. And walk, and yes, and we're Teresa, we walked 7 miles. No, I walked halfway, I walked 3.5 miles. Keep going. So everybody kept telling me it's a new normal, it's a new normal, it's a new normal. So it's just strategic.
So,
It's
do
right
you
now.
have it,
Okay,
so,
somebody do that.
wait a second, go back, because I don't know what you have next. Go back to the slide that we started in the beginning. Go back to that one.
Oh, go back,
Yeah, go back.
okay. Well, this is the first one.
No, the one before
The
that.
beginning, the beginning.
There you
Okay,
go.
so, you know what?
Oh, the lobectomy. Oh,
Yeah.
yeah. So, okay, branding, marketing, advertising, whatever. So I'm freaking out. My parents, my sister, my sister-in-law, and a friend of mine from Chicago, I text her, I said, oh my God, sorry, my life, what do you, WTF, very emotional. I'm like, I have
Oh,
to.
do you know what that means?
It Wednesday, Thursday, Friday.
Oh, no. My cousin posted it. It's like, wow, that's fantastic. I'm so glad my mom. Somebody told my mom that it means, wow, that's fantastic. Texting is so much more fun. So her mom writes, wow, that's fantastic.
It's like posting WTF all over Facebook and chaos.
Oh,
So no, I'm texting my girlfriend and I said, I think I might have to get a lobectomy, and it came out as lovectomy. And I was like,
nice.
oh my God.
The power of
That's-
speech to text.
Exactly, and I'm like, that's a message. And my sister-in-law actually, she's like, oh, that's like lovey, and there's a love, and our goal is to fill that hole in your heart with love.
Yeah.
So that was fantastic.
So tell us what that meant, because we were, do you have pictures?
Oh, yeah, I can
Okay,
go,
good, because I didn't.
I did like 10 slides, I just,
Okay, great,
Keep
because
going.
that's what I want people to hear next.
keep going, yeah, it's okay. Oh, these are my lessons I learned, keep going. So this is it, there's 3 things that I just kind of resonate when I talk to other patients and even kids who are going through something, is welcome all the love you can. So my sister, who's driving, who always does work, literally took care of 2 houses, 2 dogs, 2 children for the time that I was up. After, oh my God, I'm gonna get emotional because you guys are here. But
That's good.
it's good. Because I used to be a really badass. Like,
I love it.
but basically, so one of the things that, you kind of take care of everything, and everything runs, and the kids in the house, and work, and traveling, and you never kind of just, I never took maternity leave, I was working.
Yeah,
I was at AAA, my nickname was AAA back when I was in Farmville. And all of a sudden you slow down, and other people have to do stuff for you.
Yeah, it's hard.
Oh my God.
Yeah.
Like, and then I was on opioids, which were awesome. But I was like, wow, this is an entirely different existence for me. I'm not used to bringing me, smoothies in the morning, or making sure that I've got clothes and that mom and dad are okay. And mom and dad come, like, it's just this feeling of like, wow, I'm helpless and I have to count on people. And so a friend of mine actually designed these shirts, and she branded Simi's lobectomy, and so there's a heart up there where I don't have a lobe. And that's my daughter and one of her friends, and then some of our friends all together, and my mom and my husband and the rest of us. And that's after we did a thank you. So one of the things, the neighborhood, Teresa's looking, everybody kind of came into community, you talked about community. So I was always working, and I never really had the time, but I didn't really know the stay-at-home moms that are where we live. And all of a sudden, like, we were getting meals at our door. We were getting flowers dropped off. I was like, my kids were like, oh my God, when's the next meal train? I was like, oh, when I do better, this is gonna suck, because they are so spoiled right now, family. But it was just an amazing experience in a weird way, but it was such a
Right.
blessing, because I got to know our community. I got to meet people that I would have never probably had the opportunity to care and love, and just, yeah.
What community was this?
So I live in like the ranch and the country
Okay.
club.
Awesome.
And so there's a bunch of, Teresa's one, and my
The
sister.
ranchettes.
Yes. The ranchettes. And my sister came in like you, and my sister-in-law's behind her, so you got like the sandwich right there, Teresa. Yeah.
The sandwich.
This is the other thing, I talked to Davis about this a little bit. So one is welcome all the love you can. The other thing, I didn't realize, as much as I do hymns and healthcare, it's always about productivity, and it's always about outcomes, and how is IT connected, and billing and payments and this. But there was times where my sister was freaking because everybody was calling her for everything, all over the world. We have family and relatives from Dubai, India, and she was overwhelmed. I said, let's just do a Facebook page and post on there what's happening. And that page, we started with about 20 people, it ended up being 200 and something. But that page was actually my sanity, because when I would freak out, because I lost my voice, so the first month I couldn't speak. And then, which is really hard. And then I would have to sleep sitting out because I was afraid to lay down, because I had flatlined. And I'd wake up in the middle of the night and I'd be like, oh my God, oh my God, oh my God. And so I'd go on the Facebook page, Simi's lobectomy page, and I would read things that people wrote. And all over the world, it's different timings. So people would be on at 3 in the morning when I was having a panic attack or worrying about things. And it was amazing, because it was like, you got got this, and it sounds silly, but like, you got this, and go for it, and I remember when I met you, and you know, you've done more than this, I mean, you gave birth, and whatever. So it was great. So
She was
technology-
posting on opioids as well.
I was, yes, I was.
She would be honest, she's like, oh, I was like, but now I'm sad. Now I'm this, I'm like, oh, she's,
I was happy. It's like, why do people get up? I only have to get up if I have to go to the bathroom. This is amazing life. Like, I was pretty funny, wasn't I? Like, it was great. It was a different time for me, because it was always like, you know, be productive. What are you doing? What's your future? Why are you doing this? What's, you know, it's a revenue generating. Is it to make the world a better place? But I'm like, dude, this is awesome. And then the last one. And then this is one for me, which I didn't realize in healthcare, being the patient. So I know Sarah shared some of the blog about, you know, the moment where they start wheeling you in, I'm looking out there, I'm like, why don't they put pictures on the ceilings for the patients going into the room? Like, here, that'd be a good experience. I mean, they do it at the eye doctor, they do it, you know, the dentist, like, why don't they do it? I'm going into surgery. And I started questioning everything, so I went, and I'm sorry if you guys know this person, but I went to the head thoracic surgeon at Moffitt. My brother-in-law is a well-known physician here, and it was wonderful. And I knew all these individuals and people, and what I learned was a lot of physicians have different abilities and question everything. So I'm blessed because not only do I have relatives in the field, I understand healthcare literacy, and I can look through insurance and payers and know what's going to be covered and what's not going to be covered. And I thought, wow, okay, so let's do this. It took me 14 consults to understand actually what I had and what was available to me. My parents, friends, relatives as well, like Biblical, and I actually went in and told the physician that I ended up using, like, I want that, which is video-assisted thoracic surgery. I want this. Can you do it? My mom went with me, and I remember the physician said, well, all of us are narcissists, and she's like, you too. I remember, I was like, oh great, this guy's gonna cut me open, and my mom's like, but he loves her. She's the only one to talk back to him. But literally, like, that's the thing, like, as a patient, and today, like, there's empowering our own healthcare and understanding what we have, and no disrespect, because doctors are so busy, and they're so, they're getting algorithms, you know, from the payers, what they can and cannot do. They're seeing patients within 15-minute time frames. They're worried, you know, so they don't know your history. Yes, go ahead, sorry.
On top of all that, on a really deeper level, for you as a person, question everything, put you at ease. That's what Socrates wanted us to do. Question everything. So, yeah.
Oh, it went more than just healthcare. It was your existence. It was, it's why we're here. Yes, Davis.
I was, well,
Thank
you think about just, healthcare is lined up. Say, for instance, you go in to a procedure with your list of CPT codes that you want. You don't want any add-ons, you know, and know the outcomes. And that's what the mystery in healthcare is we've given it away to so many people that people don't realize that there's a CPT code for every procedure, and there's a payment for every CPT code, no matter what the ICD-10 code is. And so, but that's going away a little bit, but it's offering an opportunity.
And I talked to probably 9 thoracic surgeons, 11 IMs, 14 GPs, 4 oncologists, like, it's just crazy. And I learned every time even more after being there. And I thought, you know what? If I don't do this now, 3 months down the line, it's only me to blame. Like, it's really hard today. So if I can help anybody, I'm going to do that too. Yes?
I don't know what it's like here in Florida, but in California, if you explain something to a patient and they don't understand it and they make a decision based on their lack of understanding, the doctor gets sued.
So I don't know if that's here either. Really?
So I ignore that,
Yeah.
and because most of my patients in California were Mexicans, and Mexicans either have diabetes or are going to get it. And I just keep telling them, you know, you can always out-eat uphill. And they seem to understand that because they like to eat.
Yeah.
And you know, it takes a while, but understanding your disease is the first step away from fear.
I mean, I'll tell you, I had to get off, there's lung cancer groups, and I had to get off of some of them because I didn't want the
Right.
negativity. And everything, like the joke in my house is that everything had to be positive for those months. Like, my daughter and I were obsessed with Hallmark movies, because with all due respect, it was always white people who ended up happy at the end. I knew what was gonna happen. Like, that was it. I watched every Hallmark movie, every Christmas movie,
You
every...
can get up and go to the bathroom and know that you come back, it's okay.
It's okay, yes.
You don't have to stay up and watch the whole thing, because you know that it's gonna end up happy.
It was happy, happy, and that was our thing. So, and some of the blogs and some of it were really depressing and sad and scary. So, you know, everybody deals with how they can, but yes, educating yourself 100%. And if you can't do it, talk to resources. I talked to my brother-in-law a lot. I talked to, like, if it wasn't for my husband, honestly, we went into one of the surgeons and he said, "Can you tell me the procedure?" Because I was bawling and I'm like, "Oh my God, my life's over, my kids, you know." And he said, "Oh, well, we're gonna go in and we're gonna do an incision in her back and we're gonna break both her ribs and we're gonna go in and we're gonna resect and see if she's got cancer." And I called my friend, I couldn't sleep, and I said, "Okay, he's gonna do this, he's gonna break my ribs, is that normal?" And she responds with one word, her husband was a pulmonologist, "Run." And they saw my scans, they saw my, and I was like, "Oh my God, really?" Like, she's like, "I'm telling you, there's no reason he has to break your ribs, they can just do that." And unfortunately, he hadn't been trained in that. And so I'm sure he was a phenomenal surgeon. It just, I was like, and that's when I asked the one who finally did it, I said, and I went in and I said, "Okay, here's all my CTs, and it's literally like it wasn't me. Patient presents, she's 49 years old, no diagnosis, no history, went in, I had all my scans, mom knows, had everything dated from when he came in, showed it to the surgeon who didn't, and he's like, "Wow." He said, "Let me commend you on saying that you're an educated patient, and thank you. Most people don't do this." And I said, "But most people don't know they should." And that broke my heart. I'm like, because, I'm sorry, please go
No,
ahead.
I don't know if anybody read this in the 70s, there was a doctor named Bernie Siegel, and he wrote a book called Love, Medicine, and Miracles, and he spoke about the exceptional patient. And the exceptional patient is the patient that takes their healing into their own hands as much as they possibly can. And he said, those are the patients that will survive. And I laugh at myself because I think my doctors think I'm an exceptional patient. But it's really, it's a very powerful book, it's a wonderful.
Wow.
Right, but, yeah, go ahead.
I think with that too, the difference is you have to be resourced to do that. You know, not everybody can pay a copay for 14 specialists, and the reality is.
Oh, no, I just called them, they're,
Yeah.
but yeah, you're right.
Yeah,
Yeah, being in healthcare was an advantage, and I
People
feel
who
blessed.
are poor sometimes can't get to a
Yes.
doctor's appointment, let alone have a family member that's a physician. So that's a challenge, like it's really hard, and they don't know terminology. And there are just so many people that have no advocates, and they're out there on their own at the mercy of people that don't always offer the best treatments, and
Well,
it's so sad.
Yeah.
And I'm gonna throw something out there, just FYI, because I feel like, you know, I'm fairly bright. And I had a
We
thing,
agree.
even with, what?
We agree.
Okay. I had a thing about a year and a half ago with my health care, and I paid my co-payment, and I'm glad I have a friend like Davis, paid my co-payment, and I won't tell you what hospital, but they billed me for another bill. But I thought, you know how you get these things, and you're like, oh, you're just gonna wait for your insurance and all the stuff to sort out. Well, they billed me again, and they threatened to send me to collections, and I was like, huh. And I called them, and they're like, yes, we're gonna send you to collections, and I'm like, but I paid the copay, this thing's supposed to be settled. So I called Davis because he is the expert in CPT codes and all that. So we're like, okay, so we called my insurance, and my insurance goes, well, that's illegal. I'm like, could you call this billing department, because they're obviously not gonna take care of it. And they called the billing department and went, oh yes, Ms. Hand, we will take care of this. Great. But for somebody who's not educated, who doesn't have a friend like Davis, who doesn't understand that, they would have sent them to collections. And these people would, you know, for,
I paid it.
Live
right, and that would, right.
Live
It wasn't, because they were sending me to collections for like a $980 additional charge.
Yeah.
Okay, for a county that we live in where 40% of our population is asset limited and income constrained, $980 is, right, that's not necessarily pocket change. And that was one So it was not Manatee Memorial, because I would have called Kevin personally and said, hey, did you just do this, or Vernon? But it was a local entity whose billing department that they use regularly does this.
It's not in the billing department.
Well, it's
theirs.
actually every hospital does.
Yeah, and I worked
It's-
in regulated billing and things, and honestly, they reject all claims. Like, so what happened, Aetna, the medical director, you look at Aetna, November 2017, after I had my surgery.
No, so, but I
They
can tell you,
denied everything, they wouldn't pay my insurance.
Yep.
Medical, they weren't,
Yep.
and that was part of their,
And
but so I'm
it's
saying,
algorithm.
my,
and I had everything, it's an algorithm.
but
whatever it's
so
doing.
my insurance, the way, because I have this healthy person insurance, so my
Healthy person.
insurance, right, so I have a $10,000 deductible, right? So I pay $240 to be able to have the test already. So I had already paid, my insurance had given me, this is a flat rate, you pay this, and you're done.
Yep.
And they sent that on top of it,
And Medicare only paid $54 for this test.
right? So we
It
went
was
through that.
it-
I could have done better if I had been.
Sure,
a
it's
tax
not
rate.
Medicare.
Yeah,
But so
No, no,
that's
but it's
So,
based
but I
on
think, so what I really appreciate about this is that
prices.
there's almost a huge need just to have this place where, just to educate us as
Well, they have
consumers.
patient advocates in hospitals, so I started looking into that, because I'm like, just like an opioid thing.
We gave it up. We're
Yeah. But
bringing
just,
in the
there are
resources.
patient advocates
There
in
are,
the
but
hospitals.
they're not.
There's
as
not
worse.
enough.
There's
That's
not
like
enough,
complex.
and then what questions do you ask, right? You have to know
Right.
what to ask, that was the other issue.
That's like
So-
high school counselors, there's just not enough.
Yeah, you're right. Yeah, I don't know what's next.
Well,
What else can I
if Sarah so is led, I can do a presentation just on how to look up a CPT code. It is so easy, and it's right there in black and white, and in Florida, almost no insurance pays 100% of Medicare allowable. They all pay a lower percentage of Medicare allowable. And somebody's bringing this up over here. But
But,
it's,
you know,
And
so
I had all
that,
my CPTs, I had all my ICD-10s, I remember
Yeah.
the time it was 9. And I'll tell you, Aetna refused all,
Yep.
my short-term disability was not paid.
Yep.
And for the place that I did not get my surgery, sent me a bill as well. So,
and TR,
CPT stand for?
current procedural, terminology,
Terminology.
and ICD is your International Classification of Disease. So you have these two, and they come together for the payment. You have to make sure that what your procedure is matches the diagnosis, and that's how billing companies
but the
work.
diagnosis does not increase the payment on the CPT code.
so you know what the really crummy part is that you feel like crap.
Yeah,
You're
and then you're
concerned
Yeah.
that you think you're gonna die.
You're vulnerable.
You have your kids, your family, you have all
It's
this
the worst.
stuff going on,
Oh,
right?
my husband
And
and me
so-
crying every day.
Yeah, so you have this whole piece that you're dealing with, right, on the medical part, and we're not. I mean, so there's this whole piece of education, and she was already really great on that. And then, so you have to navigate this,
Yeah.
and then there's this whole journey of, wow.
Dagger through my heart.
So tell us how
Yeah.
your life has changed having gone through this with, well, what's different now?
One other question, you're coming from a background of a real good knowledge base to begin with. How much do you think you would have pursued all these questions and information and so on if you didn't have that base?
It's a great
Because
question. Probably not as much.
1 in 1,000 has your base.
Yeah, and so I got from that surgeon a 90-day supply of opioids. After about being on them for about 3 weeks, and this is when I was trying to go through withdrawal actually, and it was horrible.
Addicted,
And the first thing I thought of, and I speak on opioid addiction actually, and one of the things I thought of is like, wow, I am so blessed because I'm educated, I have the resources, I could talk to an uncle of ours and say, how do I get off this? I could research the opioids, and after 4 days, you're addicted, and it's a brain disease. And so I thought, okay, I need to make an impact for people who don't know all of this. So I'm trying to speak, and I'm trying to, being a patient advocate, on opioid addiction, on other things. But you're right, I was so physically exhausted just going through the procedures and understanding, then having to fight the insurance companies, then having to make sure everybody was okay in my house, with my sister, you know. So I don't know if I would have, and I don't know how long it would have taken. So I think if there is something, I actually thought about it, I put together a whole thing for an app, like if I have questions, like here's something the doctor said, what does it really mean in layman's terms?
Sure.
Am I febrile? I have fever. Am I this? You know, do we have this? How do you do that healthcare literacy translation for the average person? Right, you could be brilliant in your field, you could be an accountant, you could be something else, but if you don't know the healthcare literacy, you still feel like you're at a loss. Yes.
If it was somebody else, not you, for example, as related,
Dance.
the gentleman
I'm Michael.
who has
I'm an
who
MBA,
said
that
not
stands for my brother's an accountant.
who said not everyone has the education or the resources and all that. Do you think you would have survived? I mean, as in literally survived. Would you still be breathing and living
Would you be
today?
here? Yeah, I think I would be here with a lot more angst. Like, I would have gone through a different surgery. I would have had more fear and anxiety of not knowing. I probably would be on those blogs without having the discernment to understand that that was an individual's experience with their limited knowledge, with their limited, so I think I'd still be here, God willing. I don't know if I would be as positive in the outcome that I am today.
Would you would be here, and how much you would have been charged?
Yeah.
You have had $500,000,
Oh, yeah, we would have been
300,000.
charged, so, I mean,
So you would have been gone to the cleaner, basically.
Yeah.
You wouldn't have your life,
Bankruptcy.
but
Yeah.
you would have been like,
oh, I was supposed to be a patient subject. Nobody could believe it was me. Where's a pulmonologist? And they're like, there's no way you're too young for this type of, and they wanted to do samples and tests and subject matters and all this. Yeah, it would have been a very different experience with what I went through, so.
So are you taking your cholesterol medicine now?
I'm eating my way out of a pill.
Did you have a question?
Oh, those are all things that, I've really been deeply passionate about is having a place for people to go to, using the IT background that maybe you have or maybe I have, because I even registered URL like Cure Care Network, because it just seems like the information flow is just not there. And then the information that's out there is just not accurate. And so I've always kind of felt like I would love to be a healthcare advocate, but there's absolutely no money in it.
Yeah.
No one pays for it. I mean, everyone wants that service, but no one, do you know what I'm saying? And I feel like people.
But there might be an opportunity for that.
Yeah, I think so,
And the
too.
time it takes to chase down a mistake,
Yeah.
and they keep on saying, well, we're gonna correct it, and it doesn't get corrected, and then you're getting a billing notice, then that's not doing this. I mean, it's a full, I just can't imagine when I'm 80 years old, who's gonna be doing that? Protect me, because I'll be out of my mind.
Well, there's, as the information technology starts to bridge these gaps, and innovation, because the biggest birth of innovation is oppression. And that's what most of us feel when it comes to medical bills and insurances. It's an oppressive environment that innovation pops out. So CMS, easy to look up
Right.
what they pay, and they are the best payer in this country.
Yeah, Medicare, Medicaid, for sure.
Medicare, Medicaid, CMS is the best payer in this country. And so there's things that are there, they're just like right at the top. And I hope that we can go, I have a website called a blog spot that Sarah keeps on, it's called The Power of the Allowable. And you just go there and you look, you put in your CPT code and it shows you you pick your area where you want global, pricing, and bam, there's the price.
Yeah.
And so, but it's just, it's not accessible yet, like she's saying. So yes, it's there.
Well, I think the accessibility is one thing, but the education to know. So employers as well, like, so if somebody is out for a certain amount of time, I would go into HR departments, or like, they don't need to be out that long, but what they're saying and what they're not saying. So there's so many different areas, right? Physicians, I mean, I told my brother-in-law, he fought for me to get reimbursed for things. They're not listening. So there's an education component, I think, that you can have the advocate, but if I'm a patient, just like I was for this situation, and I didn't know to ask the questions, I had another option for surgery, I would have had somebody who wasn't using the latest technology and should have been retired 10 years ago, as I was told.
Right.
So, yeah. You can rely on this. That's it? Oh, good. That's all my stuff, so you can ask me whatever.
So, out of the people, out of your journey, okay, so everybody in the room is at a different stage. Some people may have been ill, some people may not have, some people, almost everybody has somebody in their life that has been touched by some kind of thing. Yep, so what would you say to the people in the room that they could do in their mindset? in the healthcare arena. So first, let's look at ourselves as individuals. What can we look at as individuals if you're facing this or facing this, some type of healthcare challenge for a loved one? What can we
Or the patient or the loved one.
So you as an individual, it's you or a loved one. How could you prepare, or what kind of decisions that you can make are different?
Well, I mean, back to those, like, give them love, use the technology, and question everything. I mean, that just kept sitting with me when I was sick. Like, I was like, and I do believe, like, so there's a mindset shift for me. It's like things don't happen to me, they happen for me. So what's the opportunity? And I know people take really
that's
shitty
great.
things and make beautiful things out of it. And I'm sorry if I'm oversharing, but John has told me your story and what you've gone through, and you made something beautiful happen out of something horrible, right? And I don't know if you want to share, that's entirely up to you, but, sorry, Deborah.
I just want to mention one more thing, one aspect here that I don't think has been covered, and that is the power of prayer. We had one of my friends come and do a yagna in a house in 2.5 hours, and I know for a fact that at the end of the yagna there was a slight bit of rain, and he's telling me that this is the God accepting your prayer. And then all of us, maybe, and everybody else that we know, all the people that love Simi so much, that everybody was praying for her, and I think that is a very important factor as well.
She'll met him in San Francisco, I know.
Amen.
Everywhere.
I believe it.
I do too.
And I think some of the hard things we walked through is seeing the blessing in that, like the fact that you had that CT scan and that was found at stage 1.
Yeah.
Lung cancer is very rarely found in stage 1.
And it's the number one case of women deaths, and they said, like, it's such an anomaly, hopefully it's one and done and nothing more is good, but you're right. And it's hard when people tell you, oh, you're so blessed.
Yeah.
Wow, that's fantastic. Yeah. Sorry, that was just a comment.
It's okay, I'm going back to what you were saying, things that I've been through in my life, one of the strangest things that my mother ever said to me, pieces of advice, were when I was going through some of the darkest times of my life, she said, praise God for the blessings He's going to give you. And I'm going through this dark time going, are you kidding me? Like, I don't even barely see light through this tunnel, and you're telling me to ask God, not ask God, but praise Him for what He's giving, what He's going to. And that's a huge thing when you can humble yourself and just try to let your faith override your fear.
So it's lovely that you said it. So we moved from Chicago. I moved at 48, 49 years of age. And I don't want to make new friends, right? We move, I'm old and tired, I don't want interviews. And one of the things, like, I thought, oh, I wish I had a community. And that happened.
Take the old one that you have.
Right? Driving my dad's old car, really fun, man, love it. It's like 2000, I don't even know.
Right, yes, Teresa.
So why are you a better version of Simi after this?
You know.
Beautiful.
You can give me before and after. Because I was friends with Teresa before it, though. But appreciation. Because I know you're going to answer that.
I can answer that. You walk a mile with joy and learn nothing. You walk 2 steps with sorrow and learn life's lessons.
No, it is. It's like everything. Everything that was more.
It's richer, more beautiful.
And it's funny, so I still play all the sports. I'm so crazy, but I'm better at tennis. She'll tell you the story.
You're
I'm
lighter?
better because I'm strategic.
You're lighter, yeah.
I'm strategic, and I know, like, I only have so much, and I'm going for the things that matter. It's, Teresa even said this today, like, literally, you know how they talk about when you put rocks in a jar, right? It takes up so much room, then you put sand in, then you put water in it. Like, what's important and what are my rocks have changed. And so I feel blessed.
Okay, so now, for people in their business,
Yeah.
what would you say from your journey, the customer journey became personal? For everybody that here who has a business or is in a business in some way, so entrepreneur, what can they take away from this to be better?
John's my mentor, we should ask him. No, I mean, everyone, this is one thing I've learned, like, I can't assume when you've gone through your own trauma, what that was.
Right, but you have your own thing, but so not like a specific, but like maybe,
General.
You took your journey and it became, all of a sudden, you became, what I see is you became more personal, more connected.
Yeah.
That person that was like oh, 49-year-old patient presents.
Yeah,
You
you're
begin
right,
to
you're
feel.
right. So now I'm kind of like, I am what I am. So I guess if there's one thing, like, it's, somebody said to me like, oh, you're sharing your story, like, that's so personal. I'm like, yeah, but it didn't help somebody sharing it. Like, you know, in business, we're so, and we even do this, like, especially when you're at a certain level, senior leadership or CEOs, you want to have this persona where I got it all. I got it going on. Like, there's nothing, I'm smart, you know. Now, I am what I am. Like,
I think I like her though.
does that make sense? Like, it's just kind of like, it is, like, love me, leave me, not sorry, like, here it is.
You said it when you said, gosh, the me now after going through this would
Yeah.
smack the girl in the head
Yes.
asking these people these questions.
Yeah.
There's a compassion for other people when you go through whatever it is, and when you've gone and you've walked those steps, and that you can't have if you haven't been through it. There's a shallowness to people who haven't had trauma, who haven't had issues.
Yeah.
You know, we all think, oh gosh, look at their life, are they, no, there's a shallowness. They can't get to that depth with the other people because they just can't connect, they don't understand.
There's a friend who, she lost her husband about 4 years ago, pretty much. And she called me one day and I was in a really bad place, and she said, you know, Sam, we're just on the other side of the wall. People don't know what it's like on the other side of the wall. And it's not that they don't want to be there for me or be on my side of the wall, it's just they've never been there, so they don't know how dark it can get. And so I always try and, sometimes I don't get into conversations if they haven't had some sort of trauma or people haven't faced that, not because I don't want them to know, but it's just,
They just can't,
it's a different, it's like a different language.
they just can't go down there.
Yeah, I'm sorry.
For people that are interested in those feelings, it's feelings of belonging. So you get a sense of belonging when you're vulnerable. And so if you read, one of the authors that I read a lot of is Brene Brown, and it's just the power of vulnerability.
Wonderful, yeah.
And just feeling like you belong. So you feel, you belong in your life now. Like you have people around you that you love, and they love you, and you know it. Do you know what I mean?
Yeah.
Maybe I'm wrong,
No,
but
yeah,
She said love equity.
Authenticity.
yeah. I think
Yeah, it's
we're
authentic.
Yeah, I'm just kind of like, yeah.
Two comments. One, I was fortunate enough to marry my insurance biller. And she says, 90 days, they reject everything immediately, and you know, and they'll continue to reject for 90 days. That's their thing. It's part of their algorithm. The other thing is, I ran into this with my daughter, who started dating this guy that was lying to her. And she knew he was lying to her, and she continued to date. And my wife looked at me and said, well, what can we do? I said, oh, insufficient pain. Once she has enough pain from being lied to, she will value honesty.
Yeah.
But she doesn't value it now. So eventually he broke her heart.
Yeah.
Then, and then she like woke up.
If you have like part of an earth that there's gold in it, to purify it, you have to put it in the fire. So you always had gold, but it was maybe some impurities in it, and if that was the fire, like for trauma, I would say, so you're only more pure. I mean, this is the image I want to leave you with you. I mean, this is the image that I want to, I mean, I don't know.
No, it's beautiful. Thank you. I love that. And I do look, like I met somebody the other day for coffee, she wanted to get together, you know, I want to talk about this later. And we were talking about healthcare in general and how to approach healthcare, and I always come at like, whether you're a physician, whether you're the patient, whether you're the hospital, like, give everybody the benefit of the doubt, that they do want the best outcomes, even though they might have different, and she came at it with like, physicians were all wrong, and this was bad, and this was bad, and I thought, you know, I can't think that way. I just want to think of it like, let's focus on the good. I always tell the kids when they get bullied or whatever, fog it out, like focus on the good. And sometimes, and my husband's like, he's like, you're always trying to look at the good. I'm like, that's the way I have to exist. Like, otherwise I feel like I can't. So, and maybe it's not realistic, but I like my life, not realistic.
Well, the truth is, you know, gosh, you know, sometimes we talk to so many different people, and when we had our first conversation, we just had this, like, we were like, yes, right.
And she's like, will you you come talk to a couple of my friends for like an after hours thing? I'm like, sure.
Right, so it's a couple of my friends. But I think there's a fixed mindset and there's a growth mindset. And I think one of the best examples of a fixed mindset that I got is with this family that I knew. And in this family, when like people got married or they had children, it was kind of like, oh my gosh, now there's like more people, and, right? And so in my family comes from a growth mindset, and it's like, oh my God, there's more people to love, because the pie's bigger, and there's more people to love, and it's more exciting, and it's exponential.
Well, and I love the story. So Sarah, I don't even remember, she told at one of her events, I remember this, you said there's people when you invite to sit. I love that, and I think it's resonating, I told my kids that. Basically, you can invite somebody to come, and that's great. And sorry, I'm saying this wrong.
So it's the,
Do you want to do it? Yeah,
okay,
keep
so
the original.
there's, this is, in my family, it's the piece about understanding that there's a responsibility. And so I learned this from my mom, and it's a part of our family culture. And there's 3 things in families, in communities, and businesses, and it's the invitation, the place, and the purpose. And so, for example, I'm inviting Simi for Thanksgiving, and so I invite her for Thanksgiving. She gets to the door, I'm like, oh, Simi, I'm so glad you're here. And she goes like, yeah. Okay. And that's the first type of family. They give you an invitation, and you get there, and that's good. And then the second type of family is, I go, Simi, I'm so glad you got here. She came for Thanksgiving. Oh, and here's a chair. There's an invitation, and there's a place. And she's looking around, and there's all these people, right? And then
I don't know anybody, but
right. But I invited her, right? That's the right thing to do. She's got a place, right? And the third type of family is, I go, Simi, will you come for Thanksgiving? She gets to the door. Here's a chair. Can you put the napkins on the table? Yes, because there's an invitation. There's a place for her, and there's a reason for her to be there. Because people need purpose in their life, and especially in today's world. There's research done years ago about how people need human contact. We need 10 hugs a day. There's research done on the monkey that is with the mama thrives, the monkey that has a teddy bear lives, and the monkey by himself, baby monkey, dies. People thrive in communities. What about
Are you kidding me? So going through what you went through, what are the things that you wish people would have asked you? Like, when you go and someone is going through a tragedy in their life or they're hurting and people always say, I'm so sorry you're going through this. Do you wish that people would have said, what do you need from me? Or that they were just there? Or
That's a great question. I think, because it's so funny, like I get pissed off when people constantly tell me you're so strong.
right?
I'm like, and I didn't mean to, and then I'd be like, oh, you're so mean, like they're just trying to say something.
Right.
But the thing that resonated most for me was that when they just said, I'm here. And that was like, I know I'm strong, I know, like I never, but it was like, I got socks that said I'm strong, one of my friends sent me a necklace with a lung. She's like, has he lost one? I thought it was cute. Like, maybe he didn't. So that was like, she'll forget one thing, and she just, what I love, this is so corny, like, she just called me to bed with me, like, I'd be laying there, and she's like, I don't need your shit, just crawl in bed with me, just be with me. Just be with me, and that was it, like, just
Tell me it's gonna be.
yeah. And it's not. We got questions here.
But it's too much place that somebody is just
I
here.
apologize, music called me, and I have to go.
Say this.
I said I have to leave at 1:15. I
No.
have really totally enjoyed meeting you. And the other people that I spoke with, think there's a lot of really fantastic people.
Let me put this right here.
Hope to
Just
see
make
you
sure
again.
if you didn't sign in, because we have to keep account, it goes to the city.
Yes.
There was something you repeated twice, you probably know, about being optimistic in your house and all that. It is something I learned recently, and to comprehend it, I enjoyed it, and this is what it is. It's not what you want, it's what you believe you will get. So when you said optimistic, because you believe it will be.
Yeah.
It's a shift of mind It took me a while to get it. It's not what you want, it's what you believe you will get. So it's good that you believe in it.
Yeah.
Because you will.
Well, and
So
there-
the strength of
There's
belief.
confusion too, there's a lot of, like, Mom Ella says, and I love it, when she says surrender. Like, there's sometimes you can't control it.
Right.
So it's like, you surrender and let know that what you believe and what you're meant to have, and whatever you will be able to do it. So that's been,
Yeah, the lesson is in the deep acceptance.
yes.
I love that term, deep acceptance, because there's a lot of resistance to the letting go. And then in the letting go is, and the deep acceptance is where I find the meaning and the relief and the joy and then the purpose, the why.
So I want to make sure, because people, we wind up at 7:30, I want to make sure that people have the opportunity to personally ask you some questions so they're not just on the record. So what I really love is the question about that piece of just being there, I'm just here. Because I get that too, where people are like, they want to tell you you're strong, or they want to solve your problem, or like, just be there. Just be there. Hold my hand, don't say anything.
My parents live 2 streets down there. My sister stayed for how many weeks on end. She didn't go back to her job. My sister-in-law came every morning. Teresa stopped by and we go for walks. Like, it's just like those things, like and I'll tell you, the people that were there during that time of trauma, we will never forget.
So, you know what, on that note, I want to say, there's a thing called joy building. And there's a Dr. Ellen Shore, you can look it up. But there is this piece where you build joy by looking at people in the eyes. And joy transfers between people at 6 cycles per second. And so, joy, and you can see it when babies do this, and you look, and they do this kind of stuff. So there's, I know. So there's this thing where you do this. So you build joy when you're happy to be with somebody. But, and we know now that the brain continues to grow, but when joy is so really powerful, is when somebody's happy to be with you, when you're not even happy to be with yourself. When you don't even feel good and your sister calls in bed with you and goes, you know, Simi, I'm here for you. So when somebody's going through something, when you look somebody right in the eyes and you're like, I'm here, you build resiliency into their life, into their spirit to help them go on. So whether it's a sickness, whether it's somebody who's growing their business, somebody who's going through some personal trauma, if we could just practice being present, right, Christine?
And all relationships.
Yes.
Yeah, all
Right?
relationships.
Yeah.
Remember, I keep thinking about the first shower, remember?
I was thinking about it. You know what I was thinking about? I was thinking about laughter too.
Oh my God, that was the opioids. No,
Laughter.
you guys sang by my bed. Oh my God, they all came, there was a mic next to my bed and they all sang all the time.
Yeah,
And
it was as hard and sad and everything, there was still, well, we knew you were gonna be okay. So the laughter and joy came, you know. But my cousin came down and we gave her her first shower after, and there was a lot of, not laughter at you, but
I was funny naked.
yeah, and, you know, my cousin's a physician, so she had stitches, and I was nervous, like, I don't wanna, you know, and so she just kind of took control of it, no, this is what we're gonna do. I said, okay, all right, do you want me to block the window? What do you want me to do? She got in the shower with her. I was kind of like, it was
confusing.
yeah.
We should have videotaped that.
Yeah.
Parts.
And this,
Like Naked and Afraid.
The Ranji version of Naked and Afraid.
Oh my gosh.
Now we go to a house and make a ranch.
It took a village.
It took a village.
So
I always
Totally digress.
feel like no matter how hard and there's always laughter through tears. That's something you know, in hard moments and hard times, because no matter what, illness, death, you know, I have a friend who just lost her husband a week ago. He was hit by a car. The worst way possible. I've been in contact with her, and through it she's managed to talk about some, you know, funny times that I couldn't believe, like, within a week, but we also had some laughs that just, you know, and I think to me, that's something very important, I don't know, that I wanted to share, that is, that, you know,
Well, that's not.
Yeah.
It brings the peace.
yeah.
Well, there are laughing clubs around the world.
Yes, there is.
Laughing
We did
clubs
that.
really work.
I think those are true, the laughing clubs, and we
Yeah.
kind of did it a little bit in
We did.
Spain.
Oh, yeah, we did. Oh,
Right?
you're funny.
Yeah.
My
That
sister
was-
led a laughing club.
That was
We did a
so
laughing
funny.
club about an hour
Because it
before.
releases a hormone
Yeah,
in
the
the
kids
body
loved
that
it.
makes.
Yeah.
Endorphins.
Yeah.
Absolutely. We keep talking about that.
So, did you have your hand raised, Mom?
A little bit.
A little bit.
It's, I mean, you're going to like a lighter subject, but you mentioned that when you look at someone's eyes, you really feel that. And I can't forget the day she came back from the hospital.
Oh, yeah.
And we were all around her and everything, but her children had not seen her for a week. And they knew that she'd gone through that. And the kids were in school that day. And her son walks in, and I told everyone, and he just walked in from the door, and he kept looking at her, and he went and sat next to her, and he just kept looking at her face. And they just, the eye contact between the two of them, it was so deep. I cannot, I mean, you had to feel that, how much he had suffered inside when she was not there for a week. We all went to go to see her at the hospital, but the kids did not go. And so that eye contact, he just kept looking at his mother. It's really her and she's here. And that eye contact, I'll never forget for the rest of my days.
That'll probably be your journey to heaven.
Yeah. Yeah, it was, I miss his depth in what it was just in his eyes.
So, is anybody different because of Simi's story?